Now I've done it. I've cut the dickens out of my finger. Well, I'm glad in a way this happened. You know, accidents do occur from time to time in the kitchen. We've never really discussed what to do. First, you must stop the bleeding. Yes, a tourniquet can be made of cheesecloth and a chicken bone.
Stop the Bleed is a national White House-initiated awareness campaign and call to action. The goal is to train bystanders to help in a bleeding emergency before professional help arrives. Uncontrolled bleeding is the #1 cause of preventable death from trauma. Severe bleeding can lead to death in 5 minutes or less. Someone's survival could depend upon you. The catalyst for this course stems from major disaster events in this country, including natural disasters, terrorist attacks, and mass tragedies. Most often, first responders can't get there in a timely fashion, or there may be more casualties than rescuers, requiring you, the layperson, to assist. The idea is not just related to disasters. Severe hemorrhaging occurs on the playground, workplaces, accidents, and other day-to-day activities. Before helping someone, ensure your own safety first. Is there falling debris, traffic, or an active shooter? You cannot help a victim if you become one yourself. Anytime your safety is threatened, attempt to remove yourself from danger and find a safe location. Protect yourself from blood-borne infections by wearing gloves if available. The ABCs of bleeding: A. Alert. B. Bleeding. C. Compression. A. Alert. Call 911 or tell someone to call 911. B. Bleeding. Find the bleeding injury. C. Compress. Apply pressure to stop the bleeding, either directly or with a tourniquet. Identify signs of life-threatening bleeding. Open or remove clothing if necessary to see the wound. Look for blood that is spurting out of the wound, blood that won't stop coming out of the wound, blood that is pooling on the ground, clothing that is soaked with blood, bandages that are soaked with blood, loss of all or part of an arm or leg, bleeding in a victim who is now confused or unconscious. Severe wounds to the arm and leg can be controlled by direct pressure or a tourniquet. Severe torso junctional wounds, neck, shoulder, and groin, can be controlled by direct pressure and wound packing. Chest and abdominal injuries, front, back, or side, usually caused by internal bleeding, cannot be stopped outside the hospital. They must be identified to EMS providers when they arrive for rapid transport to the hospital. Two main ways to tell whether bleeding is serious enough to require a tourniquet is the volume of blood and the flow. Volume refers to the amount of blood present. 5 ounces, half a Coke can be life-threatening. If the flow of blood is squirting, pooling on the surface, or flowing continuously, then it's serious, life-threatening bleeding. In this scenario, the person's arm is injured, but it looks like neither the volume nor the flow of blood indicates we need a tourniquet. We need direct pressure instead, so call 911. Apply direct pressure. Cover the wound with a clean cloth and apply pressure. Use 2 hands if at all possible in a fairly forceful manner. Direct pressure is effective most of the time for external bleeding. Direct pressure can even stop major arterial bleeding. Bleeding control requires very firm, continuous pressure. Push down as hard as you can, similar to CPR, with your shoulders right above your hands. To be effective, apply pressure with the victim on a firm surface to provide support. Don't release pressure to check the wound. If you take your hands off, you may lose bleeding control. Hold pressure until relieved by medical responders. Commercial pressure bandages are particularly helpful when there is more than one person injured. Pressure bandages are designed to exert additional pressure directly on a bleeding site. This is accomplished by the use of a hard surface embedded in the bandage. When using a commercial pressure bandage, place the hard embedded piece over the point of bleeding. All commercial pressure bandages will have a structure that allows you to reverse the wrap, do this piece tightly, to place more pressure on the wound. Commercial bandages will have a clipping device at the end of the wrap. Check the wrap frequently to ensure bleeding remains controlled. If there is a lot of blood and it's flowing really fast from an arm or leg, use a tourniquet to apply pressure. A tourniquet is a device that stops the flow of blood. If applied correctly, the tourniquet will stop the flow of blood into the extremity. Limiting blood loss may prevent the patient from going into shock or dying. Tourniquets are used on arms and legs only. Once a decision is made to use a tourniquet, you need to find one or make one. Commercial tourniquets are the most effective. If you're in a public facility, look for a bleeding kit near an AED display. Apply the tourniquet immediately if life-threatening bleeding is seen from an arm or leg. Place the tourniquet around the extremity several inches above the wound. Going higher is a better option than being too low. Usually 2 to 3 finger widths is sufficient. Do not apply directly on top of the knee or elbow joints. The bones of the joint will prevent the tourniquet from compressing the artery, which means the bleeding won't stop. If the injury is below the elbow or knee, tie the tourniquet above the joint. Preferably, place the tourniquet on the skin. For a windlass tourniquet, place the injured extremity through the loop and tighten the tourniquet above the injury, closer to the torso, tightening the Velcro strap as tight as possible. Be sure to remove all slack before securing. Twist the windlass until blood flow stops, typically 2 to 3 twists. If it's more than that, double-check the tightness of the Velcro strap. Lock the windlass rod in place in the windlass clip. Secure rod and band with time strap. Note the time the tourniquet was applied. If you have a marker, you can write it directly on the tourniquet. A wrap tourniquet, such as the SWAT, acts as a tourniquet by pressure. Place the wrap tourniquet above the wound. Overlap the first turn of the tourniquet. Subsequent wraps should be tight enough to stop the flow of blood. If it is tight enough, the shapes of the diamonds become squares and ovals become circles. On the final wrap, place fingers under the wrap to provide a space to tuck the tail of the tourniquet. If you forget to do this, do not unwrap the tourniquet. Locate a previous wrap and pull it up to make room for the tail. Apply the wrap as flat as possible. SWAT can also be used as a pressure dressing. If a commercial tourniquet is not an option, apply strong pressure with your hands or use available materials like a t-shirt or towel. To make a tourniquet, you will need wrapping material, a windlass, and a securing mechanism. The wrapping material should be broad, flexible, and strong. The windlass must be rigid, such as a screwdriver or sturdy stick, to twist the material. The windlass needs to be secured so it does not unwind. A rubber band or tying the windlass in place is effective. Key points. If the bleeding is not stopped with one tourniquet, and it is as tight as possible, place a second one, if available, just above the first tourniquet and tighten. Tourniquets hurt when applied effectively. They hurt a lot. Explain this to the victim. Pain does not mean you put the tourniquet on incorrectly. Pain does not mean you should take the tourniquet off. Once paramedics arrive, they will treat the patient with pain with medication. Common mistakes: not using a tourniquet or waiting too long to apply a tourniquet when there is life-threatening bleeding. Not making the tourniquet tight enough to stop the bleeding. Not using a second tourniquet if needed. Periodically loosing the tourniquet to allow blood flow to the injured extremity. Do not loosen. Removing a tourniquet. Only a paramedic or physician should loosen or remove it. If you don't see a lot of arterial hemorrhaging or blood squirting out, but they seem dazed, you have to worry that they're in shock. Clotting of the wound can be assisted with hemostatic dressings, powders, and sprays. Hemostatic dressings are materials that help cause the blood to clot. Packing a large, deep wound will help with manual pressure. Stuff gaping wounds with dressings. Do not cover the gaping skin, but pack the wound with material, preferably a hemostatic dressing. Children. In all but the extremely young child, the tourniquet techniques are the same for a child as an adult. For the infant or very small child, the tourniquet may be too large to wrap tightly around the extremity. Afterward, if you have been in contact with blood, wash thoroughly with soap and water to remove all blood and notify appropriate personnel of possible exposure. Surviving a gunshot wound depends on how quickly a patient goes to the hospital. Ideally, a gunshot wound patient should be in an ambulance within 10 minutes of being shot. Treatment steps for gunshot wounds typically follow the same guidelines as severe bleeding. Apply direct pressure using force. If the patient is not breathing, begin CPR. If another bystander is available, instruct them to direct pressure on the wounds. If the penetration or exit wound is large, pack the wound. If the injury is on an arm or leg, use a tourniquet. Let conscious patients sit or lie in a position most comfortable for them. Unconscious patients should be placed in the recovery position. Look for an exit wound and treat. If there is an open chest wound, the American Heart Association states that it is acceptable for a first aid provider to leave an open chest wound open and uncovered. If a dressing and direct pressure are needed to control bleeding, care should be taken to ensure the dressing does not inadvertently convert to an occlusive dressing. Remember, you are the vital link to saving lives.